Hey guys, hey gals, welcome. My name's Jodi Scholes. I'm an instructor. I'm your instructor for the MBLEx review course. So stoked to have you guys here. Got a full house showing up today. Even though technically today is the start, it's going into a Memorial Day, into a holiday weekend. And so today we are talking about kinesiology of the knee. We're going to be doing some anatomy of the knee. We're going to be doing some kinesiology of the knee, the movement of the knee, and then we're going to dissect some questions. So, a reminder, our class goes down in 3 rounds. One is a mindset test taking strategy. So, a mindset strategy, test taking strategy, uh, how to stay on top of your game, because it's more than just knowledge that gets you through the MBLEx. Second part of class is our learning. And then the third part of class is dissecting questions. First part of class. So, I wanted to invite you to go ahead and consider referring a friend. Do you have a friend who's studying for the MBLEx? Isn't it always better together? Maybe you guys could like actually meet on a Thursday or meet at a certain time and watch a video. Refer a friend to the program. Tell us that you sent them. Yeah, because the we don't have any special offers. We don't have any like, you know, buy one, get one or whatever. If your friend needs a special offer, reach out to us. But what we have found is that when you have skin in the game, meaning you're paying to be here, you pay more attention. Yeah, you take it more seriously. And I'd like that for you, and I'd like that for your friend as well. So consider referring a friend. Yeah. Wanted to also let you know that the link you used today is the link that we are going to use right straight through until the end of June. Yes. So if you're watching this later, if you're watching this years from now, and you're enrolled in the MBLEx review course, know that we have one link that we use for 12 weeks. That helps you to stay organized when it's time for class. I don't know about you, but sometimes about 10 minutes before class, I'm like, okay, do I have everything I need? Do I have my water? Do I have my notebook? Do I have my pen? Okay, where's the link? Ah! So that link you can put in your calendar straight through the end of June. However, breaking news. Uh, we will not be having class next Thursday. That's May 28th, next Thursday. We won't be having class. And that is because, well, it's on the tail end of a holiday week, but also I wanted to walk the talk with you, meaning take a week off. And Tara and I, before class started, were talking about the importance of rest. It is the only way for you to unplug. Such a beautiful thing that the universe designed our bodies. The God as you know it, designed your body to need rest. And we get to do that every night. We get to rest. And now and then, we're just going to press pause in our studies because studying for the MBLEx can feel like this like big black hole of energy, this big black hole of, will I ever learn enough? Yes, you will. You will learn enough. Uh, and you will learn enough. You will be passing those practice exams. But every now and then, we do need to unplug from the grind. And so for next Thursday, you get a day off. You get a day off from the grind. So, are you ready? Well, not that this is a grind, right? We're having fun, we're learning, but you get a day off to rest, to recharge your batteries, to hang out with friends, to do something fun. And that's what I would challenge you to do. On Thursday, next week, do something fun. Do something just for yourself. Take yourself out to lunch. Yeah. Or go out to lunch with a friend. Do something that's fun because life is meant to be lived. Life is meant to be enjoyed. And your career, what you choose as a career, is what is meant to be enjoyed as well. So let's get you ready for your career as a licensed massage therapist. Let's get into our studying. Hey there, hey. All right, here we go. Kinesiology of the knee. Kinesiology technically means movement of the knee, how the knee works. What are our learning objectives for today? Our learning objectives are, by the end of the session, you'll identify the bones, ligaments, and tendons of the knee. You'll describe the location of bony landmarks of the knee, and you'll understand the movement of the knee. Kind of fun, huh? Now, here's a fun fact. The lower limbs, the lower structures contain about 30 bones. And we're going to be focusing on the lower body today, focusing on the knee. But in the lower body, there's the femur. It contains 30 bones. The femur, the patella, the tibia, the fibula, tarsal bones, metatarsal bones, and our toes are called phalanges. We are going to be focusing on the knee. So let's take a look at our region. When you have an MBLEx question, when you're taking a practice exam and when you're taking the real exam, figure out the region of the body that you're in. Then you can focus in, really dive into what you do know about the question. Some of the questions on the MBLEx are going to throw you off. They're going to be like, what in the world are you talking about? Look for the words that you do understand. Look for the areas of the body you can identify. So let's take a look here. We've got an anterior view of the leg, and we have a posterior view. Right here behind the knee is called the popliteal fossa. The popliteal region has the popliteal fossa. Here in the front, we've got the patella. Just below the patella, we've got the tibial tuberosity. We're going to go over these in detail in just a few slides, but I wanted to give you the regions that we're going to be covering today, or some of them. We've got a pes anserinus, that's an attachment site. Got the gastroc here. Underneath the gastroc, we've got the soleus that turns into the calcaneal tendon. Got the tibialis anterior muscle over here. We're going to take a closer look at that one today. The shaft of the tibia, so that bone is called the shaft. We mentioned that the soleus turns into the calcaneal tendon, the calcaneus. We've got a lateral malleolus, a medial malleolus. And as you look down, here's the tendon of the tibialis anterior. And just thought we'd throw in there, this is a great slide from Books of Discovery. And they pointed out the extensor digitorum longus tendons as well. So this is the region we're in. Let's take a deeper dive, shall we, into the knee? So we look here at this joint, the knee joint. And as you're studying anatomy, as you're studying kinesiology, you'll want to know which bones make up the joint. And so in this beautiful picture, we see the patella. The patella is called the kneecap. Can you put your hand on your kneecap? Yeah, that's your patella. Immediately below the kneecap is the patella ligament. So we see some bones here, right? So this bone on the top of the top part of the knee. So a joint is made up of two bones. And in this case, the bones we're talking about are the femur and the tibia. Now, there's not an articulation with the fibula here. The fibula articulates with the tibia. So just like the radius and ulna, The fibula articulates with the tibia in two areas, but here we have the tibia and we have the fibula. So the fibula is a little smaller, so it's like telling a little lie, a fib. So the fibula is a little smaller than the tibia, but where the tibia and the femur come together, that is the knee joint. Sounds pretty straightforward, right? Yeah, just want to be a bit clear about where we are in the body. So there's a structure we're going to take a look at just below the patella ligament. And I wanted to review uh, a navigating the body term. We could say that the patella ligament is immediately inferior to the patella or the kneecap. So the patella ligament is under, it's below. And another way to say that is it's inferior. Yeah. So in terms of directions, inferior means lower. Superior means higher. All right. So this is our largest sesamoid bone in the body. Let's move along. It's embedded into a tendon, and that makes it the sesamoid bone, by the way. A bone embedded into a tendon is considered a sesamoid bone. Now, the only sesamoid bone you're going to need to know is the patella. Yeah. So it's the largest. And yeah, good. On this slide, you'll see new words, the valgus test, and the varus test. We're going to look at those a little bit later, but they are stress tests for the knee. So if there's a knee injury, a doctor or a physical therapist or a chiropractor will do a valgus stress test or a varus stress test. And we're going to take a look at a video on that just a little bit later. But we're introducing new words. This joint, this knee joint, where the femur hits the tibia, is called a hinge joint. And here's a picture of a traditional hinge. Now, if you are in your kitchen, or if you look in your kitchen, you will see that your kitchen cupboards, many of them have hinge joints. This is also the name. So that cupboard door opens one way, right? It flexes and it extends. But this is a picture of that hinge joint where those two bones come together. And there it's buried under the patella, but you see the top of the tibia, and you see a little bit of the bottom of the femur. So where else do we have hinge joints in the body? Hmm? Let's see. Can you put it in the chat? Yeah, put it in the chat. Where else do we have a hinge joint in the body? Let's see what we got coming in. Oh, Megan says the elbow. Yes, we do have a hinge joint in the elbow. Very good. So here's a picture of the elbow where the humerus meets the radial ulnar junction. So the humerus technically sits in the ulna. And you'll see that's also a hinge joint. And if you're sitting on a laptop right now, you'll see laptops also are considered having a hinge where that top flexes with the bottom. And so at a hinge joint, we can do two things. We can flex and we can extend. Now, you may say, wait a minute, Jodi, there's more than just flexion and extension of the lower arm. You would be correct. There's supination and pronation, right? So supination and pronation. So our elbow is the hinge joint. I'm going to give you the bigger visual here. So the elbow is the hinge joint. But we could also flex and extend, right? Excuse me, flex and extend. Also, supinate and pronate. Supination and pronation happen at the radial ulnar junction. So that's a movement between the radius and ulna. We think of it at the elbow. Technically, the two joints involved in supination and pronation are the radius and ulna. Try it. Put your elbow on the table. Don't move. Flex and supinate and pronate. The elbow doesn't move. Right. So we have a hinge joint at the elbow as well. Where else do we have a hinge joint? We have it. Oh, did anyone else answer? Okay. Also at our fingers, at our phalanges. These are considered hinge joints. Yes. Now, the other thing about the hinge joint is that uh, it is a part of the six joints that are synovial joints. So, synovial fluid is going to come up again in a little bit in our lesson. But we have freely movable joints, and those freely movable joints are called synovial joints. Yeah, and those move easily. We have other joints in the body that are either semi-movable or immovable. Again, it depends on who you talk to. Uh, but just know that the joints that we're talking about today are in the category of the hinge joint is in the category of synovial joints, and they are movable. Now, as we talk about joints, we're talking about bones, right? And we're talking about muscles, and we're talking about ligaments, and we're talking about tendons. All right, so what do ligaments do? You can put that in the chat as the first answer, first part of the answer. What do ligaments do? Going to be learning some ligaments today. Names of some ligaments. What do they do? Okay, okay. Maybe you're not quite sure what ligaments do, so what do tendons do? Let's try that question. What do tendons do? Let's see, let's see. Ah, we got one of these answers correct. Sorry, I didn't give you enough time to type, I think. All right. So what do ligaments do? What do tendons do? Ligaments, oh, got another answer. Thank you, John Robert. Thank you, Shireen. Tendons attach muscles to bones, right? And John Robert nailed it with ligaments. It connects bones to bones. So both ligaments and tendons are made up of a substance called connective tissue. Most of it is collagen, but connective tissue. Ligaments attach bones to bones. So the patella is a bone, the sesamoid bone, and the tibia is a bone. So the patella ligament connects the sesamoid bone to the tibia bone. Yeah, ligament. So that little spot that we have, that little ligament we have under with that feeling like right under your your kneecap, there's the patella ligament, and you know it's attaching a bone to a bone. Now, tendons, on the other hand, attach the muscle to the bone. I'm going to see some more examples of this. So here's our nice big quadricep muscle. It turns into a tendon, and it inserts behind the kneecap. So there's that quadricep muscle in the front of the leg. When you follow that front of the leg all the way down to the top of the kneecap, if there was a 12 o'clock on the kneecap, 12 o'clock, that's where that tendon inserts into. Let's take a look at the bony landmarks of the knee, shall we? There are a few. Here's our femur. Oh, you guys are getting so good at the anatomy of the lower leg. You're getting this. So there's the femur. There's that big bone, that big thigh bone at the top of the leg, right in here. Beneath it is the tibia. And let's take a look at a couple of bony landmarks on the tibia. In the front, we've got something called the tibial tuberosity. Now, if you've never heard of the tibial tuberosity, no problem. From that word, you can tell it's on the tibia, right? So it's on the tibia bone, the tibial tuberosity. And tuberosity just means bony landmark. And you can actually feel it usually on yourself. It's right at the top there, right under your kneecap. There's a little soft spot under the kneecap, and then a real hard part of your tibia. That's your tibial tuberosity. Just medial to the tibial tuberosity, there is a site called the pes anserinus. I don't think I'm saying that right, but that's okay. You're just going to have to read it, hopefully not have to say it. But here's your Pez dispenser. Did you ever have Pez dispenser as a kid? So Pez and Cernus. Yes. And the Pez and the Pez with the word that looks like answer. So it's like the Pez is the answer. The answer is it's on the knee. It's on the medial aspect of the knee. Ah, Tara's giving you a little hint there as far as memorization. Too many boys, tendons connect muscles to bones. Little boy blue, ligaments connect bone to bone. Very good. Love that. I've never heard that. It's awesome. All right. So Pez with the answer. If you need an answer to the Pez question, the answer, see how the answer in this looks like the word answer? The answer to the Pez question is it's the medial aspect of the tibia. Yes. And you'll see, here's some words you maybe recognize, and that's the medial condyle, the medial epicondyle. We have these on other bones too. So they'll on the MBLEx, they'll be naming the bone and then giving you a medial epicondyle or a medial condyle. All right. Anything else I want to show you here? I think that's good. Let's talk about that pes answerus, shall we? So why do we care? Why do we care about this? Well, the reason we care is because it's often tender. It is often the site where athletes feel some soreness, some tenderness, and it can be the site of a pathology. It can be the site of an injury. So take a look of the three muscles that come together and attach here. So we've got your sartorius muscle, that big S, crosses two joints, starts at the lateral aspect of the hip, comes across that front, and it attaches on the knee, well, on the tibia. So it's not attaching to the femur. It's attaching to the tibia, which is why we're talking about it when we're talking about the knee. Okay, the gracilis. The gracilis, a beautiful, beautiful adductor muscle. Sartorius is a hip flexor and also helps to rotate the hip out because it attaches on the outside angle there. And then, of course, semitendinosus, one of the hamstring muscles. We've got our semi-sisters, right? The semitendinosus and the semimembranosus. Now, I have never seen this term on the MBLEx. Um, I doubt it would make it. I don't know if Tara, you've ever seen this term before, but they are comparing the pes anserinus to a goose foot because of the shape. You see here, this little shape that it makes, kind of these three tendons that come together. That doesn't really help me to remember it, but it was an interesting comparison. I don't think it would be on your MBLEx because I don't know if that's taught in all schools. But why do we care again about this pes anserinus? It's a hotspot. It's a hotspot for inner knee. It's a hotspot for knee pain. It can be caused by some inflammation, bursitis in the knee, so bursa sacs maybe in the knee, or a tendon strain. They could actually strain this tendon. But it's highly relevant. This area of the knee, it's highly relevant to people who have arthritis, people who train with bicycling or running, yeah, or lateral movement, tennis, really to athletes in general. So we have that shared attachment of those three muscles. Uh, and then we've got a little bursa. It's actually called the pes answer bursa. So we've got knee bursa that's exclusively in the knee joint. Got a little pes ansora bursa that sits between the shin bone and the tendons to reduce some friction. Again, this is getting very microscopic. You probably won't see that on the MBLEx. But once you know where you're living, what region you're living in, when we talk about the pes answerness. Excellent. Lateral view. This is the medial aspect of the tibia. So back to our bony landmarks. We pointed out the tibial tuberosity. We're going to move over here from the pes answers to the tibial tuberosity. And I loved this picture. So the tibial tuberosity is a bony landmark. It's a bump. It's a bony bump on the front of the shin bone. So it's just below the kneecap, and it's an anchor point. It's an anchor point for your patellar ligament. So remember, ligaments attach bones to bones. Here is your patella, and here is your tibia. And this is actually labeled incorrectly. It's the patella ligament. Oh, I loved this picture. I didn't even check it for that particular mistake. I didn't see that mistake. So the patella ligament attaches the bone to the bone. And here we have the quad tendon. And that's a big difference, you guys. So when we're looking at the questions on the MBLEx, you know where you're located when you see the patella tendon, the patella ligament, but they might ask you which is superior, which is inferior. So the patella tendon is actually the tendon that comes into the patella is from the quad. So take a look. If this tendon, see the quad tendon? Yes. It is also sometimes referred to as the patellar tendon. Yeah, it is. And then the patellar ligament is inferior. It's attaching the bone to the tibia. One other part of the knee that is important is we have several parts that we're going to be going over, but the meniscus. Now, have you heard of the meniscus? Yeah. Okay. So what does it actually do? So there's four things I wanted to point out to you that it did. One is this. Okay. And so the meniscus is this little C-shaped thing right in here. It's actually two parts. So right there under the femur. Yes. It is in between the femur and the tibia, and the meniscus acts as a shock absorber. So it actually helps to, like, as we're walking, as we're running, just, as we're jumping, it helps. The meniscus is a is actually like a pad. It's like a jelly pad. Um, it's like a pad that a jelly pad that you would kneel on in the garden, right? It's a gel-filled, C-shaped uh, part of the body. The meniscus also helps with weight distribution as you do lateral movement, and it evens out the weight distribution from in the knee joint, so from the femur to the tibia. It gives it joint stability. It has a crescent shape. And let's see. And then lubrication and nutrition. It actually helps to move around synovial fluid. So it's not filled with synovial fluid. It's filled with a different substance, a gel-like substance that lets it be a little squishier. Uh, but it helps to circulate synovial fluid, keeping that joint um, lubricated, nourished. So I didn't want to leave without talking about synovial fluid. So synovial fluid is like a gel-like substance. It's thick. They call it viscous. It's like the same, it's a little bit thicker than mucus. Well, some mucus can be very thin, I guess, but it's a thick gel-like substance that's located. So all the purple stuff is synovial fluid. And it's located in your knees, but as you might have guessed, synovial fluid is the reason that our movable joints are called synovial joints. They have synovial fluid that keeps them lubricated. It's like the oil in the joint. And its primary function there is to reduce friction. Yep. So it that reduces friction. So between the joints, and that way they can glide smoothly and hopefully painlessly. Okay, we've got some good bony landmarks of the knee. We've got some good anatomy of the knee and function of the knee. We know the knee flexes and extends. And so let's take a look at the muscles that touch the knee, that impact the movement of the lower leg. Just a general review of some of these lower leg muscles. Here's our patella, embedded in the tendon, embedded in the hamstring tendon. Back again, here's our tibial tuberosity, so the front of our right leg here. We're going to touch base again with this shaft of the tibia. So that front of the tibia right down here, that shaft will be in the front. And from the side view, we're going to look at the back of the leg too, but from the side view, you can see the gastroc. And in this picture, these are called they're calling them the peroneals, but they're also called the fibularis group. So you may hear it called peroneals. You may hear it called fibularis group because they're a group around the fibula. And in the back, we'll see another picture of the soleus. Uh, but here, we'll see another picture of this tibialis anterior. Tibialis anterior touches the tibia. The peroneals or the fibularis muscle group is much more lateral. So here's our pinky toe, this grouping of those peroneals. Good. And we've covered ankle and foot muscles in the past, but here are those tendons. So the extensor digitorum longus. Look at this bad boy. Comes right down into the toes. Now this covers our extensor digitorum. It covers the digits of the toes. Extensor hallucis, another word for the big toe, right? We've got our hallucis, the big toe, and we've got our pollex, right? The thumb. Those names are a little bit different. And if those names are new to you, go to our medical terminology lecture in the 2025 library and review some medical terminology. If you're feeling a little lost on the names right now, go review some medical terminology. Uh, and also navigating the body. If this is feeling a little overwhelming, time to sit down and watch Navigating the Body. Any one of them will do. If it has one that does lower leg, go for that one. But hallucis longus, hallucis digitorum longus, uh, it is one that you'll need to know because I don't know if it will be on your MBLEx, but it'll just be good to know. Another great issue. So you can see that tibialis anterior sits right on the side of that tibia. Here's our hallucis, the big toe, hallucis longus, and hallucis, the digitorum longus, both foot muscles. But they go straight up. This allows for dorsiflexion. These two muscles allow for dorsiflexion of the foot, along with tibialis anterior. Oh, I wanted to point out one thing. You see this? It looks like a little clear, almost like a belt crossing this ankle. That is something called the retinaculum. And you'll learn more about that when we do foot and ankle. If you want to learn more about that now, you can go look at the foot and ankle video. But this retinaculum is lovely to massage. It's a thin layer of connective tissue that helps to keep the tendons and ligaments in place. It's beautiful to massage. Try it sometime. And this is palpation. Another look at that retinaculum. But here's the tibialis anterior. And looking at this extensor digitorum longus. So the digits, right? The four digits of the toes. You can see, I just thought this was a great picture. Let's take a look at flexion and extension, the actual movement of the knee joint. This is going to be done sitting down. Most people have lost
Habit of
the
fully
habit.
extending their knee and elbow joints. When working on knee extension, you might find these visualizations helpful. Picture your knees as if they were like ostriches, bending backward to enhance the sense of extension. Imagine there's an eye or a light at the back of the knee, which needs to open fully or shine brightly as
So opening fully, shining brightly out of the back of your knee is helpful for full extension.
you extend. Focus on lifting the kneecap to engage the muscles required for full extension.
Go ahead and lift those kneecaps. Think about that when you're standing up for, again, full extension.
Aim to reach 100% of the movement's potential, not just 98%, ensuring complete extension. Finally, in different positions, push the back of your knee up when prone or down when supine to maximize the effectiveness of your extension.
And there you have it. There you have extension of the knee. Let's take a quick peek at flexion, shall we?
Seated knee flexion and extension. In this example, the operative leg is the patient's right leg. Sitting upright with your thigh supported in a chair, bend your operative knee as far back as possible and hold for 10 seconds. Fully straighten your operative knee as far as possible and hold for 5 to 10 seconds. Then relax. In general, this exercise will help to strengthen your knee and thigh muscles, and it will help you regain range of motion in your knee by your
So this is a post-op knee they're talking about, but it perfectly demonstrates flexion and extension. Extension being the bringing the knee straight, flexion bringing the heel back.
2-week follow-up appointment, you should be able to fully straighten your leg and bend it at least 90 degrees. Work up to 5 reps, 2 to 3 times per day. Do this exercise with each leg. Don't hold your breath while doing this exercise.
All right, there you go. That is demonstrating flexion and extension. Now we're going to take a look at the muscles that complete these movements. Knee flexion, that is bringing the heel back towards your butt, or if you're sitting in a chair, just sliding it back to at least 90 degrees. And the primary movers for flexion are the hamstring group. Now, there are 3 hamstrings. They are the primary movers. Knee flexion also includes not only the hamstrings, but also peripheral muscles, gracilis, sartorius, gastrocnemius, plantaris, and popliteus. Now, you don't have to remember all of the auxiliary muscles, but you do need to understand that the hamstrings are responsible for flexion. So most of the knee flexors also help to internally and externally rotate. Again, we're talking about bending the knee, which is known as flexion, and flexion and extension are opposing muscle groups, right? They're reciprocal muscle groups, so the opposites. Here is a picture of the hamstring group, and it will of the muscles that move the knee into flexion. And you can see there's a lot of layers here, right? So here's semimembranosus, semitendinosus, and then biceps femoris. Those are our three hamstrings, our semi-sisters and big brother bicep. So take a look at gracilis and sartorius. These are all in here as well, but let's strip this away. Just looking at the hamstrings. And you can see here from this little image, when those hamstrings contract, they get shorter, it brings the knee into flexion. Yep, so it brings that tibia and fibula closer to the butt, bringing the heel closer to the butt. So that's a little stripped away. And just so you can see, this is the gracilis muscle. It is actually an adductor. It is a contributor to knee flexion, but it's not a primary mover. Just that's why have you focus on the primary movers. Yeah, very good. Now for extension, the quadriceps. The quadriceps, they call it the quadriceps femoris, but quadriceps are four muscles, vastus intermedius, medialis, and lateralis. So you can see by their name, medial and lateral, and then intermedial. So the three vastists are quadriceps, and then there's our big rectus femoris. And they bring the knee into extension. So bringing that tibia out in front of you. And so the quadriceps are the agonist, and there's two synergists here. So helper muscles, the ITB, the IT band. It's an extensor. It's also an extensor of the knee, but not all the way. So only when the knee comes beyond 30 degrees and into full extension does the IT band kick in. And then TFL, the tensa fasciolata, works with the IT band, and TFL is right above the IT band. And here's a look at those quadricep muscles. But here in blue, vastus lateralis, red, medialis, and then the yellow rectus femoris. We're missing a vastus, but that's okay. You get the idea. Front of the leg, looking good. Back to the posterior muscles, the posterior compartments of behind the knee. So look at where these things come up and attach. Here's our gastrocnemius. The gastrocnemius does not attach to the proximal aspect of the tibia. The gastrocnemius attaches to the distal aspect of the femur. Yes, very good. Below the gastroc so you see this gastroc has two heads. The soleus has one. It is this white, it's represented by this white. It all comes together here. The gastroc, the soleus turns into the Achilles tendon or the calcaneal tendon, as it will appear on your MBLEx. So the Achilles tendon is the calcaneal tendon. And here's our calcaneus, the heel. See, nice bone here. Good. So you'll see we've got a couple muscles of the posterior compartment. Again, here the plantaris muscle. We've got that popliteus muscle, and you'll know the popliteal region, right? Yeah, very good. And a little bit of origin and insertion. We did mention this, that the origin, this helps. This is one of the muscles that helps to flex the knee. Yes, flexing at the tibiofemoral joint. And that's how you'll see the knee named on the MBLEx. This, you see, after the A here, follow it over, flex the knee, the tibiofemoral joint. Yeah, then probably not going to call it the knee. So just pause, be like, okay, I got this. And so the gastroc also plantar flexes the ankle. So it plantar flexes the foot. Technically, that movement is happening at the ankle. but this gastroc helps to flex the knee. And so it starts up here on the bony landmarks of the femur, and it inserts all the way down here at the calcaneus. So, fun fact about the gastrocnemius, it crosses two joints. What two joints is the gastrocnemius crossing? I hear you. Yes, the knee and the ankle. Good. Quick look at the soleus. Technically, if you have to choose between the gastroc and the soleus as to which actually becomes the Achilles tendon, the soleus really is part of the Achilles tendon. Gastroc chimes right in there too, but it's kind of like that goose foot. But the soleus is under the gastroc. This also helps to plantar flex the ankle because the soleus does not attach to the femur. Let me hide this picture. Let me show you. Head of the fibula. So we've got it. This soleus is starting right here at the tib-fib juncture. So it starts here at both, but it does not cross the knee. It comes down here and inserts into the calcaneal tendon. And the role of the soleus is to plantar flex the ankle. So to go up on your tippy toes. That's your gastroc and your soleus working. Ah, here we are with 3 pictures of the knees. Can you tell the difference? So here is what we call normal knees. Here's what we call a little bit of a knock knee. A knock knee. And then can you see how this one goes out just a little bit? You can see it. Now, in just looking at these pictures, we know there's normal pressure between the femur and the tibia in the quote unquote normal knees. By the way, this particular, they might call it a deformity, but this particular difference, most people are born with it. Yeah. So the majority of us are born with kind of straight angles, but some are born with what's called a bowed leg. So these are a bowed angle on the far right of your screen. And then this is called a knock knee. They go in a little bit. Now, just looking at the picture, where would the ligaments be stretched? If we're in this image number 1, middle is neutral, but looking at image number 1, on which side of the knee are the ligaments stretched? They're stretched out. Is it on the medial side or is it on the lateral side? One side is stretched, one side is jammed. Can you tell which side is stretched? Which side is stretched as we look at this knee? Is it medial or lateral? John Robert, yes. Shireen, yes. So, correct. In picture number 1, on the medial aspect, those ligaments are slightly stretched, whereas on the lateral aspect, they're going to be slightly squished. They're going to be shortened because that pressure is on the inside. Okay, let's look at set of legs number 3. So if these are pressing out, so a little bit of a bowed leg here. Now on this bowed leg, which aspect is going to be stretched a little bit further than normal? So is it going to be the medial aspect that is stretching, or is it going to be the lateral aspect that's stretching in this bowed leg? So which area is stretching? Shireen says lateral. That is correct. Because just ever so slightly, it's a little bit elongated. So it's like, oh, because it's pushing out. Yes. Now, as we look at these angles, there's two ways that you might see the words varus and valgus. We're going to pause here and take a look at the video of a varus and valgus stress test of the knees. Now, it will be very helpful for you to have looked at those knocked knees and the bowed legs. Let's go ahead and share. Now, bear with this guy's accent. He does a good job explaining. Oops, I need to share with sound. Thanks for your patience. So you are going to see a valgus stress test of the knee. Valgus. So we're going to be dealing here with the medial collateral ligament. We're going to be dealing with the knocked knees, right? We're going to be kind of pushing in the direction of that knocked knee. Let's watch.
In this video, I'm going to demonstrate the valgus stress test for medial collateral ligament injury in the knee joint. Hi and welcome back to Physio Tutors. The valgus stress test has been evaluated in a study by Harry Lane et al. They rated the sensitivity at 86% and the specificity was not reported. To conduct this test, have your patient in supine lying position with the legs fully extended. Now with your patient in supine position, instruct him to relax as much as possible during the test. With one hand, grab onto the lower leg just above the ankle joint, and the other hand is used to fixate the femur. Then, slightly externally rotate the tibia and perform passive abduction in the knee joint, and thus putting stress on the medial collateral ligament. You're looking for excessive gapping on the medial side and the reproduction of pain.
This is not a test that we will do as massage therapists. This is a question that we might get on the MBLEx, a varus or valgus stress test. So valgus stress test is testing the medial collateral ligament. So we've got a medial collateral ligament here. We want to see if there's any damage to it. And so this physio is pushing with his left hand against the femur. So it's putting pressure on the medial ligament. So a valgus stress test, knock knees, valgus is testing the medial collateral ligament. We'll watch the end.
Consequently, perform the same test with the knee in 20 to 30 degrees of flexion. Again, you're looking for excessive gapping on the medial side and the reproduction of pain. Take a look at this table, which lists all of the structures you would assess with the valgus stress test in either position. Alright guys, this was our video on the valgus stress test. I hope this video was helpful to you.
All right. And we are just going to look at the valgus today because the varus tests the lateral collateral ligament. The way I remember the difference between the stress tests is that valgus has an L, but it is medial. So valgus has an L like it wants to be lateral, but it's medial. So the valgus stress test is the medial collateral ligament. If you were to get that question on the MBLEx, you would be in the zone of tough questions. Like that would be a hard question because we're really on the fringes of what you need to know. If that were to happen though, you can be like kind of happy about it because that means you're doing really well in that category. If you're getting those hard questions, you're doing well. Let's go back to our PowerPoint. Yes. So that medial collateral ligament where it's stretched, this is that valgus stress test. This would be called a valgus pressure. There would be valgus stress on the knee. Again, it's another medical terminology. And one of the other ways that I remember valgus versus varus. So varus has an RUS. And this is just my crazy brain. So varus has an RUS. Walrus has an RUS. Have you ever seen a walrus? They've got those two lateral fangs, right? Those two lateral teeth. Well, the varus stress test, those two lateral teeth are the lateral collateral ligaments. One of the other crazy ways I remember things. Thought I would share it with you. All right. We have done enough for this session as far as our learning. Who knew there was so much to learn about the knee, right? Yeah. Let's go into dissecting some questions, shall we? Wanted to mention too, we've got just a few questions for you today. So we'll be finishing up in the near future. But before putting your answer in the chat, I'd ask you to please just wait until I say 3, 2, 1, go. And that way everyone has a chance. And we're going to practice the 60 seconds that you have to answer the question. We're going to use all 60 seconds. I'm going to use my timer. And we're going to use all 60 seconds on that first question so that you feel what it feels like. And it's going to be uncomfortable to wait. But we're going to look at many different aspects of the question, and only at the 45 seconds will I say 3, 2, 1, go. Just want you to see what it feels like. Ready? The blank is the largest sesamoid bone in the body. Blank is the largest sesamoid bone in the body. Okay, let's take a look at our answers. We have 4. The MBLEx is switching to 3. And we're currently at about 14 seconds. A, the femur. B, the patella. C, the greater trochanter. Or D, the medial malleolus. All right, the blank is the largest sesamoid bone in the body. We're only at 30 seconds. Let's take a look and see where all of these items are. Put your hand on your femur. Put your hand on your patella. Put your hand on your greater trochanter. Where's that one, huh? Do you remember? And put your hand on your medial malleolus. Okay, 3, 2, one, go. Very good. Yep. All right. We are at now 70 seconds. That is the amount of time you have for each question on the MBLEx. 70 seconds. Good work, John Robert. Alexis, yes. Shireen, Rob, Sarah, boom, boom, boom. Yes. It's not the medial malleolus. Nope. It is the patella. The patella is the largest sesamoid bone in the body. Good work. All right. Next question. The blank is the common insertion point for the sartorius, gracilis, and semitendinosus. The blank. All right, let's take a look at letters A through D. A, the lesser trochanter. B, the ischial tuberosity. C, the fibular head. Or D, pes anserinus tendon. The blank. All right, put your hand on your lesser trochanter. Put your hand on your ischial tuberosity. Put your hand on the fibular head. And put your hand on the pes anserinus tendon. Three. Oh, wait, let's get rid of one wrong answer. We know that it is not the ischial tuberosity. Nope, not an ischial tuberosity. Those are our sit bones. 3, 2, 1, go. And we're at 70 seconds. Were you able to get this question? John Robert says yes. Megan, yes. Rob, Shireen, Alexis, good. Excellent. Best answer, letter D, the pes anserinus tendon. Did you know that before class today? Did you already know that? Do you know the areas, do you know where lesser trochanter is? You need to know where all three of these things are, all four of these things are, to be honest with you, because they could all come up on the MBLEx for sure. Now, you've got 660 muscles. You don't need to know all of those. But these bony landmarks, you need to know. And the majority of the bones, you do need to know. 206 bones, and lots of them have the same name, like the phalanges, right? The metatarsals. I mean, there's over 108 bones in our hands and feet. So think about it. Really only about 100 bones you need to memorize. So, and some bony landmarks as well. Okay, next question. This is a classic stress test of the medial collateral ligament. This is a classic stress test of the medial collateral ligament. It's called the blank test. A, the various test. B, the ACL tear. C, the varus test. D, the valgus test. Which of these looks familiar? You might see an image. There's usually only 2, maybe 3 images on the MBLEx. Let's get rid of one wrong answer. It is not an ACL tear. That is a pathology. That is an injury. This is a test. We're not testing for something. They said this is the test. So 3, 2, 1, go. This is a classic test. Let's see if you remembered. Sarah, yes. Rob, you got it. Megan, uh-huh. John Robert, you're in. Very good. Best answer. Ooh, got one more. Ah, best answer. Pick one. Pick one. Because I like your chances at 50-50. Don't answer. You can't get it right. Go ahead. We're gonna go ahead and let's see. Alexis, you're in. Shireen, good guess. Best answer is it's not a various test because various isn't even a word. Boom. It's the valgus test. The valgus test. So the way I remember that is that L is not going to throw me off. That valgus test, right? Should stand for lateral, but it doesn't. It stands for the medial collateral ligament. Good. And you can learn a little bit more about the valgus test of the knee. We just saw it demonstrated. Next question. The blank is a thick substance that reduces friction between the bones during movement, allowing joints to glide smoothly and painlessly. A, mucus. B, synovial fluid. C, meniscus. D, bursa. All right, let's look at that question again. The blank is a thick substance that reduces frictions between the bones during movement, allowing joints to glide smoothly and painlessly. Let me point something out. Today, we were talking about the knee, right? We were talking about the knee. So we're thinking all knee stuff. This question is a little bit bigger than knee stuff. It says the blank, a thick substance that reduces friction between bones. It doesn't say the tibiofemoral joint. So this is a little bit bigger. So that'll help you to eliminate one wrong answer. So it allows joints to glide smoothly and painlessly. All right. Let's get rid of one wrong answer. It's not mucus. That comes out your nose. That doesn't help with reducing friction between your bones. All right. We got 3, 2, 1, go. Let's see what we got for answers. John Robert and Sarah, yes. Shireen, you're in. Megan, you're in. Best answer. Boom. Synovial fluid. So it doesn't sound like fluid when we say substance, but a thick substance. This is thick substance. This is like very viscous. Synovial fluid occurs in all of our synovial joints. Bursa shows up in different ways. Bursa shows up in our joints, but it shows up in different ways and for a different purpose. And of course, the meniscus is only in the knee. Good. Nice work. Next question. These muscles extend the knee. A, the hamstrings. B, the IT band and the TFL. C, the quadriceps. Now you get to remember which is flexion, which is extension. Okay, let's get rid of one wrong answer. It is not the IT band and the tensor fasciae lata. Nope. Okay, what do you think is the best answer? Is it the hamstrings that extend the knee or the quadriceps that extend the knee? Ah! Okay, here we go. Best answer. Boom. It is the quadriceps that extend the knee. Remember, extension is bringing that tibia, that lower leg in front of you. It's actually straightening the knee. That's extension of the knee. All right, next question. These muscles flex the knee. Is it A, the semimembranosus, semitendinosus, and biceps femoris? B, tibialis anterior, gracilis, and TFL? Or C, rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis? This is more like what you'll see, by the way, this is more like what you'll see on the MBLEx, the names of the muscles, not the muscle groups. So you're going to have to know which muscle groups are named what. So these are the muscles that flex the knee. So where are we? What movement are we doing? Flexion. So we know it's not going to be tibialis anterior, gracilis, and TFL, right? So flexion of the knee, A or C? Let's take a look at them. What muscle group is A? What is it also known as? What is muscle group C? What is it also known as? Okay, best answer. The muscles that flex the knee are, boom, A, semimembranosus, semitendinosus, biceps femoris, also known as the hamstring group. Yay! And that is that. We had knee specific questions today, or synovial joint specific questions today. Nice work. Nice work. Oh, and I wanted to mention, because I did a slide on it, boom, next week is client assessment. So what you saw happening today with that physical therapist, that physiotherapist, was a client assessment. It's a little bit beyond the scope of what we do because we're not diagnosing. But next week we're going to be talking about client assessment, and it'll be visual assessment, so general assessment, postural assessment, gait assessment, palpation assessment, and range of motion. Yes. Oh, thank you, Shireen. Week after next. Yes, you caught me. I'm so glad. Thanks. I'm so used to going week to week. Yeah, so it'll be our first week in June that we are doing the client assessment. So postural assessments and all the things. Great. Well, I'm going to hang out with this crowd for a little while longer, take any questions that you may have on our material, but I'll wrap up the recording saying my name is Jodi Scholes. I'm your instructor for the MBLEx review course. We'll see you again real soon.